Hello there, John the Osteopath, here again with some more fun exercises for you to try. Now, I've got a client of mine and she's got a rotator cuff problem, specifically the supraspinatus. Now the supraspinatus is a little tiny muscle that runs from the top of your shoulder here all the way down and into this area. And what it does is it helps to stabilise your shoulder joint. In fact, with the other rotator cuff muscles, it brings the shoulder joint nice and tight, it maintains the position, and also helps with the initial abduction of the shoulder. Now, if it's damaged, it can cause quite a few problems, and consequently, the other rotator cuff muscle starts to take over, and then you get further knock-on effects. Now, it's still important to try to train this muscle if you can, and so you want to try and train it, but reduce the amount of pressure on the area. So one thing I want to try and do is pump blood into the shoulder, okay, and the other one I think I want to try to do is reduce the load on the supraspinatus muscle while still working the other muscles in the area. In particular, the external rotators. Now, the external rotators, their job is to move your arm into that position like so. You don't have to, of course, you should do that movement, but what would help is to maintain the movement in a static position. And commonly you see people doing lateral raises like this with a bent arm. The only thing is, of course, as I said before, it's seen that the first 15 degrees of abduction is taken up by supraspinatus. So just by lifting even here, although the pressure is less than if your arms are completely straight, it's still going to cause a little bit of irritation. So one way to try to reduce the irritation is by changing the angle at which you work. And you can do it completely flat on your side or propped up at an angle. Now, I like to lay down like so my body is at a bit of an angle, 45 degrees, or you can be completely flat on your side where you can barely see me like this. Okay, but we're going to stick at this angle just for today. You will then take a weight, a very light weight ideally, not a big one you would normally choose because it's going to be a lot harder to do it from this angle. And you're going to grab hold of the weight like so. The arm is bent at 90 degrees and you're simply going to lift the arm to 90 and to lower. And lift again and to lower. Now I'm not looking out at the top here because up here there's not really much work going on. But the advantage with this exercise is it makes the deltoids work a bit harder. So they're assisting with the motion and they're kicking in a bit sooner, and so supraspinatus is not doing as much work. At the same time, of course, because your elbow is bent, you're working those external rotations, the ones that normally do this motion, like so. Okay, now you can do this with a bottle of water, or you can use it with a few kilos in weight. And try and do this just for a few reps, get a nice pump in there, slowly and carefully, up and down. Okay, now if that is a bit too easy for you, what you can try and do is with a straight arm, and you can bring the arm all the way to the side like this. And the only disadvantage with this movement is you're not getting the external rotators to work. But again, same thing, you can bring it up and down. Of course, the load is greater now on the deltoid, so it's having to work a lot harder as well. So there's a good progression from the initial exercise to move on to this one. And of course, normally you want to try and do between 6 and 20 repetitions, very carefully. Now the other way to try and to involve the muscles of the posterior shoulder girdle is to change the angle again. Instead of having your arm perfect down by the side, you can bring the arm slightly to the front over here, and you can lift it in this kind of action. Okay, not to the front completely because that will be rear deltoid only, but you still want to at the middle deltoid and some of the external rotators. So the compromise is your arm pointing down at about 45 degrees from horizontal there, grabbing the weight again and lifting and lowering and lifting and lowering like so. And rest. Fantastic. Okay, enjoy those exercises. You can try all three if you like, or just choose the one that suits you the most. I've done it in 3 progressions, starting with the easiest to the most difficult. But do try them all. Make sure, of course, that if you get any pain, you stop immediately and modify what you're doing. Any questions, just get in touch with me and I'll see if I can answer them for you to a satisfactory conclusion. Otherwise, enjoy this video. See you in the next one. Do take care. Goodbye.